As we move into the latter half of the year, the annual enrollment period for Medicare is upon us. It's also open enrollment for most major employers. So, what does this mean for you and why is this important? Well, we are dedicating this coming month to reviewing the benefits arena, and we'll start with Medicare. Then we're going to move into more traditional employee benefits, and we're going to round out the month with federal employee benefits. So the key is to stay ahead of the season, ensure that you maximize what is available to you, and identify and potentially fill any gaps that may exist for your unique situation. And with that, I'm Nikki Foley, and welcome to Paladin Financial Talk. This is our weekly podcast that helps you make smart financial decisions with clarity and confidence. With that, I'm Nikki Foley, and welcome to Paladin Financial Talk, our weekly podcast that helps you make smart financial decisions with clarity and confidence. This week, we're going to address Medicare benefits. So, coming from Minnesota, this has been a really interesting leading up to Medicare annual enrollment time. There's been a significant disruption in the health insurance landscape this season. And specifically, it started when UCare, a major carrier here in the Twin Cities in the local area, they made an announcement that created a ripple effect that impacted many of the other carriers. So when a large player makes a change like that, it doesn't just affect their members, it forces the competitors to also respond, reevaluating their offerings, pricing, coverage, and so forth. So that means many retirees across Minnesota are seeing changes. They might have new choices, new costs, and in some cases, they may see their plans discontinued. So with that in mind, the key to all of this here is at Paladin Financial, it's our job to be really well equipped to make sure that we're flexible so we can offer the effective solutions for whatever your needs are at this moment. And so let's talk just a moment about UCare. So UCare made the decision to exit the Medicare Advantage market for 2026. Now, it's really important that as we say that we know what plans were actually impacted, because they're continuing to offer and they remain committed to Minnesotans through their medical assistance program, so Medicaid, through Minnesota Care, through their special needs plans, through individual and family plans, and their Medicare supplements. So when people, and this is how it happens on the Medicare side of times, often people are talking about their healthcare coverage. It's really important that the conversation is not blanketed that UCare is exiting the market, but instead, very specifically, the Medicare Advantage market and what pieces of that. So, with that in mind, let's talk about three key things that we're going to cover today. First of all, I want to talk about the timeline of what to expect from the annual enrollment period, so AEP. Also provide a summary of what you can do during the annual enrollment period. And then finally, what action can you take during this time? And making sure that you understand why it's so important along the way. So let's start with the timeline of what to expect. So the Medicare annual enrollment period, also known as AEP, runs from October 15th through December 7th each year. The changes that you make during this time actually go into effect on January 1 of the following year. So in this case, January 1 of 2026. Let's dive into that just a little bit deeper. So by September 30th, you should have received an annual notice of change letter. This comes from your provider, your carrier that you're working with. So the insurance company. This might be United Healthcare, Blue Cross Blue Shield, Medica, the names that you're used to seeing. So they have until September 30th to provide that letter. In reality, it is not a letter. It is more like a booklet. And so they are providing you a side-by-side list of what your current coverage looks like. And if there's any changes in a category, they tell you what the new change is. So as an example, if your copay changes for a specialist and it goes from $40 to $60, They are going to list that on your annual notice of change letter, and you would have potentially multiple lines showing you what is changing. Again, they have to have that in your hand by September 30th. Now, your Medicare agent who you are working with, they cannot start having conversations with you about 2026 until October 1. So while there's a lot of communication that's going on in the media and these insurance companies are advertising their products and they're talking about who they are, or you're seeing something come in the mail potentially, really, you're not seeing things about 2026 until after October 1. And that's when your agent can begin talking to you about the 2026 plans, the next year's plans. But you can't take action to enroll until October 15th. So on October 15th, this is the first time you can enroll in a plan with your agent. So that's the general timeline. And again, that this closes on December 7th for an effective date of January 1 of the following year. So what can you do during this time? Here's what your opportunity is. During this window, you can switch from Original Medicare to a Medicare Advantage plan. You can move from one Medicare Advantage plan to another Medicare Advantage plan. You can switch from a Medicare Advantage plan back to Original Medicare, and you can join, switch, drop your prescription drug plan or your Part D. One thing that I want to take note of is we said nothing about Medicare supplements. What happens is Medicare supplement, also known as a Medigap policy, attaches to Original Medicare. So you have to get yourself back to Original Medicare before you can make a decision about doing something with a Medicare supplement plan. The other thing that happens that is oftentimes when you're on a Medicare supplement plan, because it is not guaranteed, it's not a guarantee issue product. Oftentimes, once you're on a Medicare supplement plan, you are not making the decision to come off of it lightly. So there may not be a situation where you're moving between Medicare supplement plans in the same capacity that you would do with a Medicare Advantage plan or a prescription drug plan. So one thing that is unique, and I point that out because one, you don't see Medicare supplement listed as something you can do during this period. It's because you have to get back to Original Medicare before you can make a change if you're going to do something. You have to go through a health screening questionnaire or the health questionnaire and the screening portion if you are going to apply for a new Medicare supplement plan. So it's a little bit more complicated to navigate that. But what is unique with UCare this year, leaving the Medicare Advantage space, you become eligible if somebody has or is on a UCare Medicare Advantage plan. They become eligible to enroll in a Medicare supplement plan with guaranteed issue. So any questions about that, I highly encourage you to reach out to a financial or your Medicare agent to make sure you understand how to navigate that. But again, it is unique because the Medicare Advantage plans are coming out of the marketplace. Then that makes those who are on a Medicare Advantage eligible for a Medicare supplement. Now, what should happen during this time? One, you want to make sure that you check your doctors and your providers. Are they still considered in-network? You should review prescription drug coverage. So formularies change every single year, so make sure your medications are covered affordably. And then just evaluate your cost in general. Make sure you know what your premiums are. Make sure you know what your deductibles are and your out-of-pocket limits. That may look a little bit different. So with the disruption that's happening in Minnesota this year, as an example, it's really important because there's probably going to be a number of moving parts as these insurance companies try to control costs. They may be making shifts. Everything that we are looking at so far, there's pretty good chance there's going to be some level of shift, and you just have to be prepared for making sure that you're evaluating that and knowing the moving parts. And so for Minnesota residents, this is, like I said, a year that's had some disruption. Make sure that the plans you've relied on, that you know what they still look like. They may no longer be available, or, like I said, look different. So the earlier you review, the more options you have. And let's go to the third item here. So action items for you. What can you do during this time? We've drilled this down to 3 steps you can take right now. Schedule your annual review. This is an opportunity for you to work with a Medicare agent, and they are the ones who have been trained. They have received the information firsthand from the insurance companies. And so sit down with your Medicare agent to look at your current coverage and see if this still aligns with your needs in 2026. In preparation for that meeting, it's encouraged that you pull your prescriptions together and get your provider list put together. When I say provider, that means anybody that you're seeing. It could be your regular primary care physician. It could be a specialist like a cardiologist. It could be a dermatologist. It could be your physical therapist. Think broad of those that you are seeing, even if it's once or on a routine basis. Make a list. I highly encourage you to make a list of exactly how you spell their names, but also the location that you might see them. A provider oftentimes does not just service a single location. They may service 1, 2, 5, or more locations. And so where do you want to see them? Make sure that you write that down. Same concept goes with prescriptions. There's some very specific pieces that are important to list out for your Medicare agent when you're meeting with them. First one, make sure you know how to spell the prescription. Know what version you're on. Maybe it's an extended release version. Pay attention to that. The frequency, the dosage, all of that is going to be important. So the number of milligrams, do I take it 1 time a day? Do I take it 3 times a day? Having that listed out is really important to make sure we get the right things put into the system and we do it efficiently. So having a complete list of what you take and who you see will help you ensure your new plan or even your existing plan still meets your needs. Then finally, don't wait till last minute. Oftentimes, you might want to think about what your options are. Give yourself time to do that, but advisors' calendars fill up quickly. So your insurance agents, they may be working a very heavy schedule right now. And so the earlier you act, the smoother the process will be. Again, so many key pieces here. One thing that fits into probably the timeline piece is there's something that you have to sign before you move forward with talking with your insurance agent, your Medicare agent each year. Scope of appointment. It's not just each year, but anytime that you are working with them and you're talking about the opportunity to do something new, you would need to sign a scope of appointment form. And so just making sure that you leave enough time to get that completed before you meet with your Medicare agent. It has to be completed 48 hours before you meet with them. And so from time to time, it may feel like you're getting a lot of communication from the insurance companies, you're hearing it in the media, but what you're not getting is direct communication from your insurance agent or your Medicare agent. That may be because you have some restrictions in place, like that October 1 timeline, that they can start talking about 2026 products that are available. It may be we got to make sure we get that scope of appointment form in place. And so just be curious as you go in to work with your Medicare agent that you have checked your boxes and you're doing it in a timely manner where they have time to react and you have time to react as well. And with that in mind, at Paladin Financial, we believe preparation is power. That is why we do these financial and educational podcasts. Medicare is certainly not a one-size-fits-all. It works for you. It has to go along with what's going on with your health situation, which may be different today than it was a year ago. And it's all ties back to the bigger picture, which is your financial situation. And that is why we host a financial podcast, but bring in so many additional other topics along the way, because most of the time, it all ties back to the bigger picture of a financial situation. So take advantage of this season. Use it to stay informed. Use it for education to make sure that you have a really good understanding of what your plan looks like and how to take it full advantage of what you have and make really good intentional choices. And so next week, we'll continue our conversation on benefits. We'll move away from the Medicare conversation and we'll move into employer-sponsored coverage because open enrollment season is just right around the corner for a lot of major employers. So whether you're still working or helping a loved one navigate their business or their benefits, you won't want to miss everything that we're talking about this month. And like I said, we're going to wrap up at the end of the month with federal employee benefits as well. I'm Nikki Foley. Thank you for listening to Paladin Financial Talk. If you have any questions about your Medicare coverage, you can reach us at 651-842-8406 or visit us at paladinfinancial.com. We're here to help guide you every step of the way, and we look forward to an opportunity to partner with you. Thanks.